I'm Lee Doherty Biddison.
And I'm Carolyn Kamsty Fowler, and we're your co-hosts for the Johns Hopkins Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share what we're learning.
Thank you for joining us.
Hello and welcome. I'm Lee Doherty Biddison, Chief Wellness Officer for Johns Hopkins Medicine, and your host for this episode of the Vital Conversations podcast. My guest today is my dear friend and colleague, Jennifer Katzenstein. Dr. Katzenstein is a board-certified pediatric neuropsychologist and the co-director of the Center for Behavioral Health, Director of Psychology, Neuropsychology, and Social Work at Johns Hopkins All Children's Hospital. She also is an associate professor of clinical psychiatry and behavioral sciences in the Johns Hopkins University School of Medicine. She's an international and national speaker on topics ranging from mental health of children to physician well-being. And her passions include building behavioral health services for youth and their families, as well as ensuring the well-being of the workforce, with a specific focus on workplace violence. Jen, thank you so much for being here today.
Lee, thanks so much for having me. I'm so excited.
I've really been excited about this conversation, and I would love to just start with giving you a chance to tell people, what it is you do every day. You've got your fingers in a lot of different pies.
It has been an interesting evolution over the past few years, especially as we went through the COVID-19 pandemic and really saw, I think, society and across the world, people recognize the importance of social interactions and mental health and well-being as part of our overall physical health, and that mental health and physical health are truly one. And so as a neuropsychologist and developing behavioral health services and growing our behavioral health services here at Johns Hopkins All Children's, it's really evolved into being very mindful and thoughtful about our team members across every component of the hospital, including our environmental services staff, our dietary staff, our support team members, our medical staff, every nurse, every physician, every person who works here, what their well-being looks like and the well-being of their family, because we have been through, especially here in Florida, so many disasters. Last year, we had 3 hurricanes on the west coast of Florida that significantly impacted our teams. And recognizing that you can't just walk into work and forget about everything that's happening at home, that still continues to impact you. And you have to be taking care of all aspects of yourself in order to be the best possible provider, the best possible team member when you come into work every day. So it's evolved from really taking care of our patients and families to taking care of all of our families, regardless of how they present here at the hospital, either as a team member, as a patient, or anything else.
I can imagine that, let me just say it this way. There's traditionally those two sort of categories of responsibility within an institution are separate. Somebody's sort of responsible for the internal team, somebody's responsible for the patients and their families. And you have this unique role where both are drawn together. I'm just curious about your sort of, at dinner at our family, we do highs and lows, but the pluses and minuses of having this all,
Yeah,
brought together and where you see the balance falling out.
that's a great question. And I was trying to think what my highs and lows of dinner last night would have been, right? Because every day brings those challenges. And there's times where our patients are taking more of our attention or taking more of my attention, and there's maybe our issues or things are going well. But then also our team members are coming to me with their concerns. And so when you say the word balance, I often think about it as more of a rhythm, because it tends to be more of a flow for me than nothing's ever 50-50. And
Love that,
definitely, nothing ever kind of equals out in that beautiful way that I wish it would, but it won't. And some days I have to remind myself of that last week, for example, I had probably at least 8 of our team members reaching out for support of some type, either for themselves or for a family member, for an external referral. And as a psychologist myself, I know psychologists, I know what kind of training I like to see. And so I want our team members to be going to the best possible therapists and counselors in the community. And so I am looked to provide those recommendations. And I'm super mindful of that because I don't want to necessarily endorse anyone, but I want to make sure our team members are getting the best care, whether that's through EAP or a RISE program or an outside provider. So sometimes it is for me taking a step back and taking a deep breath when I'm overwhelmed by all the modalities that people can talk to me with, right? Whether they're emailing me, texting me, Teamsing me, asking for a Zoom meeting, or using secure chat. I'm getting all these messages bombarded, and I need to take a deep breath just to be like, I can get through it all. This is okay. And figuring out that, again, I kind of left that balance word out of my vocabulary because it sets up an unfair expectation in my own head.
I love your approach to that because I do think it's, in well-being in general, there are ebbs and flows. And there's I've sometimes used this analogy of it's like a hit workout. Like no one went into healthcare to have a perfectly balanced life that that everything you will get to do all the things that you want to do every single day at, calmly and at the perfect time. We, came into healthcare because it's meaningful, because we care about people and want to support them, because we're accustomed to hard work. And the hit analogy, just as you're talking, is sort of the go as hard as you can for a period of time. But remember, you can't continue to do that on an ongoing basis. You have to stop and your body has to recover. Whatever, muscle group you've done your hit workout with that day has to recover. And I love that notion. There were some times doing well-being work early on where people, would just sort of zone out because the idea would be, oh, you just want me to work less, take it easy, chill. And that's just not how I'm wired. And being able to bring to the conversation, no, go hard and, keep moving forward. Just remember that you have to recover.
And I think that point is so important because anecdotally, it was said to me on Tuesday night out of a place of caring, but it was hard for me to hear that burnout was real. And it was a comment that was made to me about my own behavior, right? And as a oppositional, right? Right. And as by an oppositional person, maybe by nature, my first thought was, oh yeah, wait and see, right? You don't tempt me on that. And then I have to take a step back and think about it. And remember too that not all those people that see me going hard see me when I'm not going hard. Does that make sense? And so they don't know that in 2 weeks, I have a 2-week vacation coming up where I actually won't have cell service for an entire week.
Can I come?
I'm sorry?
Can I come?
Please come. Oh my goodness. You are so welcome to come. I'm really excited about it. Absolutely, Lee, you're invited anywhere that I go. And so I had to step back and say, we also make a lot of assumptions about the people around us, right? That was an assumption that I go hard and don't take that recovery piece. And just because you don't see it doesn't mean I'm not doing it in a way that's good for me. And I think that's one of the biggest pieces for me in talking with people about their well-being is I want to be a meditator. I want to do the deep breathing. It's not who I am. And as a psychologist, that also goes against like all of our coping strategies that we would share with you in the first couple sessions. But I think it's about finding what works for you and what that, to your hit analogy, workout is you're coming down from that going hard piece. And that doesn't mean it's sitting quietly breathing or meditating. It's whatever works for you. And I want people to hear that more.
No, I love that because it's a challenging journey. I mean, I think the other thing very often, type A folks in healthcare, we're pretty formulaic. Just tell me what to do that will make me feel better, or help me to de-stress or whatever, and I'll go check the box. Maybe I'm giving away more of my own personality than all of healthcare, but I think it's not uncommon for us to have that kind of approach. And I think that self-discovery journey is kind of vulnerable and uncomfortable sometimes.
Absolutely. And I think so often, too, to your point about things being formulaic, our whole futures have been laid out for us, right? Everything for me for grad school, what you do for your residency placement, your fellowship placement, it's all a match. You get to give your opinion on it, but there's still a match. And so you don't get your full autonomy.
Yeah.
And then suddenly we release you into the world and say, well, go do what you want to do. And we haven't allowed our trainees to make those decisions for the past 10 years. And so have we trained them to even be able to say, what do I enjoy? What does make me happy? And have you ever been asked that question?
Right. And have it be okay to give your honest answer and not have it be something like working 80 hours a week.
Gosh, I mean, right, the standard question, at least in psychology, is, where do you see yourself? And if you don't respond to academic medical center, then that's a red flag.
Yeah.
And so that's just, to your point, that's exactly right, Lee. Like, what's the correct answer? Well, the correct answer is whatever is right for you. And sometimes if I'm talking to a trainee about that, they're at a loss because they've never gotten to make that choice independently before.
So important to create those spaces
Yeah.
and balance all of that with circling back to our earlier comments, balancing all of that for the employees with figuring out what this means for patients and families.
Exactly.
I would love to. We've had some conversations outside of, this conversation right here about resourcing. And by that, I mean, we're sort of resourcing the work. And I would love for you to just sort of give us your thoughts on what it means to resource appropriately the work that you're describing and that you're overseeing now. Like, how do we know when enough is enough? How do we have those conversations about, again, the resources that we need, be they, human resources or otherwise, to do this work?
Such a great point. And especially for me being in behavioral health, resourcing for me is brains. It's humans. I don't need fancy equipment. I don't need MRI machines. I don't need ORs, right? I need a room and a brain. And so when I think about that, I think about myself and those of my team members that are just stretched, are so willing and excited to take on new opportunities and new engagements that we have. But then when is enough, and when are you at your breaking point, right? Like, I feel like there's days now where I'm thinking to myself, like, this is a lot. Like, this is probably not sustainable long term. And then in this funding atmosphere and in this atmosphere, just from a, financial viability perspective, how am I going to advocate to have a component of my position or anyone's position be well-being focused? Or thinking about how, especially workplace violence prevention that we've been working on so diligently, that is a very emotionally challenging area, but also requires a lot of human resourcing, because we need people being able to work on projects and work with challenging patients and families who are in the hospital and in our outpatient care centers. And I think that's a harder argument to make sometimes, right? Like, a piece of machinery, an MRI machine, comes with a cost, but it also comes with some type of revenue that's going to be associated with that, right? And we, in well-being and in workplace violence prevention, that revenue piece is harder to really demonstrate because it's often in that cost savings, retention, having a
Cost
health
avoidance.
barrier,
Yeah.
right? Workforce.
Yeah,
Oh,
it is tough. And there's also a lot of conversations happening in the well-being space. I had one of these conversations just a month or two ago about the fact that, we're sometimes get trapped into the ROI discussion. Like, show me how this is paying for itself, or show me, even if it's a cost avoidance strategy. And, trying to figure out in very complex times how we shift the conversation towards this is just the right thing to do. Even if the cost analysis either can't be worked out because it's so complex or doesn't fall in our favor, it's still the right thing to do. And how do we shift towards that? It's not easy.
and it's so interesting that you bring that up, because it's such an easy response sometimes to say, well, what is the ROI? Right? And then we get tied up trying to answer it. And for the first time in the 5 years that I've been director of social work, we have no open social work positions right now. Our retention has been so
Awesome.
strong that, knock on wood, I'm knocking on wood for everyone listening, there isn't an opening, and we actually have people who are waiting for a position to open. that isn't that exciting? And so it's anecdotal, right? And it's not data driven in the way necessarily that someone wants to see it in a dashboard or specific metrics. But we've developed a culture over the past 5 years that gets people coming here, wanting to be here and staying here, such that I have a staff that isn't running ragged, trying to cover all of these units with open positions, right? I'm not stretching the bandwidth or asking for extra shifts because we're where we need to be and not incurring the costs of recruiting someone new. And not only having the gap, right, but that new recruitment to bring someone in. So that has been, one of those things I think I need to really highlight a bit more. Like, this is a culture that we've completely overhauled, and wow, has it been a success.
Absolutely. Well, can we dive into that a little bit?
I
Like,
love that. Yeah.
let's say one of the other hospitals in our health system, or somebody from, I don't know, Western Kansas said, Jen, tell me how you did this. We're struggling to retain social workers. What would be your sort of like top 2 or 3 things that were really important to that transformation?
One of, I would say, the most important things we did right off the bat when I ended up in this role was I met with every single social worker individually and talked about what was going well and where they saw challenges and where they saw opportunities. And really sat down once we met with everyone and laid it all out. I'm a big fan. Lee, you've been to my office. There are Post-its everywhere. Big Post-its, small Post-its, line Post-its. And we put them all out on the big Post-its, and we started to see where could we have some quick wins and show this team that their leadership was dedicated to improving and listening. And then where were things that were going to be longer term plans and where were things that, probably had to, I really dislike using the parking lot terminology, but probably had to be put on hold for a little while.
Yeah.
And HR at that time gave me a stoplight report. And the stoplight report has been something that we do quarterly, where we show our green accomplishments over the past quarter or the past even 6 months. Yellow are things that are in progress, and red are things that are on our minds but are posing challenges to get moving right now. And we tell them why. And so just seeing that and knowing that the concerns that they're bringing to their one-on-ones are bringing up on a daily basis that are challenging to their daily life are still on our radar, I think has been huge. Really. One of the other things right off the bat was, just like any team, some internal communication challenges, and really resetting our mantra to be, is it kind, necessary, and true? And it's on every agenda.
Yeah.
Is it kind, necessary, and true? Are we talking about things that need to be talked about? Are we building healthy professional relationships? And then we sat down as a team and said, like, what are our 10 communication values that we are going to bring every day? And then that was a nice way to hold accountability when we weren't meeting those things, because then the last part of it was, if you were not accountable to the things that we had decided as a team were going to be our communication, were going to be the values we bring to work every day, then we had a conversation about it. And some people self-selected out of that. And for the team to see that we were going to not only listen but hold accountable, I think completely changed the culture overall.
One question that's just running through my mind as you're talking is this scalable? Can you scale the culture transformation you've just described? And I'm just curious about your thoughts on that.
There's a couple things I have in my head often about this. One is managers and those who oversee team members are so important to have some of those skills and even just a standardization of that. I would love to see every team have their own stoplight report. And, is that something that could happen? And I think that from a not being in an executive leadership role, but probably understanding maybe that there are challenges to get everyone on that same page. How do you set that expectation with leaders and get the buy-in? And so I think if you can do that, that's magic. And then the other thing, there was a Midwestern Children's Hospital I had heard about during COVID that had put up signs in their staff areas of just be kind. And part of me wondered too, if maybe sometimes is it that simple? We in St. Petersburg here, if anyone has been here or you drive around, there's a movement with just happiness signs put up on random light poles. Okay, so yeah, so you just like might be driving down the street and you see on a street sign or on like a light pole, the electrical poles, you know, the utility poles, red, yellow happiness sign. And it always just makes me wonder because our thoughts are so tied to our behaviors and our emotions. Like, is it as simple as just reading "Be kind" or seeing happiness to initiate some type of thought process change, right? As a psychologist, some type of cognitive behavioral intervention that might be able to set that culture differently. You know, I really would love to study that more closely.
Let's do it.
Right? We should do
We should totally
good
do
at
that.
signage, you know, be kind or, you know, I've said this to you before, like no one talks to you more than you talk to yourself. So like,
Right.
can you change one thought a day about yourself? Right? One time where you got mad at yourself about something or you were frustrated and said something in your head that you could easily reframe to be kinder or more positive.
No, I love that. I was thinking I've got a whiteboard over here, and I need to change the mantra on the top. So be kind might go back to the top. Right now it says good things take 10.
Oh, I love that. Every day at 10 a.m. in my phone, to your point earlier, my reminder goes off that says, you can do all of this. Like just as a reminder, like when you're feeling overwhelmed. But yeah,
I love
maybe
it.
it's just that simple, right? Man.
Something that disrupts the train of thoughts
Mhm.
that we're struggling to that we probably didn't start. We're triggered by something else. And we're struggling to stop some disruption there. Yeah, for sure. I love that. Well, another thing that I was curious about your thoughts on is, as you are taking care of this broad spectrum of individuals who engage with all children's, starting from patients at their very earliest to your most senior staff. Um, are there things that a lot of times I would say like challenges that we have in our work relationships or any relationships in our lives or come from experiences that we have in childhood. This, very common, and you will be able to speak much more succinctly about adverse childhood events than I can. But the whole, sort of psychology of that, and as we think about engaging with our adult staff, one of the things I've actually given some thought to is should we have a more trauma informed approach to people's burnout? Like, what happened that got them into this cycle of behaving in this way? But my bigger question, and we can absolutely run down that rabbit trail if you want to, but my bigger question is: are there things that are happening as we engage our patients when they're very young or earlier on? Those future clinicians who are patients now that will make a difference down the line, um, specifically in this context.
I think absolutely. These are so many great questions and so many paths we could take here, Lee. I think about this, especially this teenage generation right now, who is so mindful of their boundaries and their behavioral health and are really using terminology that we as adults are adopting and makes me think back to my own childhood. Like gaslighting is probably one of my favorite terms that sometimes when you take a step back and you are reflecting on your own behavior, reflecting on a relationship and the other person's behavior, our kids are getting better and better at this, and I am so curious to see how it sets them up for the future and how if they're forming just these nice, strong relationships with appropriate boundaries in place and, thoughtful conversations surrounding expectations in a relationship, will they be able to carry that over to their work? And when I think about for myself, for example, and even in my own, therapy situations where I'm the patient with my psychologist, right, who sees me, we talk about family of origin and how each of us is really shaped by the relationships we observe early on and the expectations in those relationships, maybe in our parents' marriage or divorce or next relationship, and how we communicate, how we cope, and what we see to then be that sets the expectation for what your future relationships look like, whether that is in your personal life, if it's in your work and professional life. and how those interact. And so I do think that the things that we do now make a difference long term. And as we talk more about well-being, and as our kids and certainly our teenagers are doing such a remarkable job of recognizing their own kind of and defining their own psychological concepts, I am so excited to see how that opportunity can evolve in the future, because this is a generation that has an amazing opportunity to use technology and use the stigma reduction to completely disrupt what we all have been, setting as the expectation and for decades in terms of, work life integration and, how hard you work when you're at work and pushing and pushing and pushing that I think we're coming around to, but they're more ripe to really follow through with.
Have to, the older generation has to unlearn some things that hopefully are those who follow us after us are learning the first time around, for sure.
Right. Exactly.
You mentioned the concept of stigma related to mental health. I'm curious about your perspective on how successful we are being in healthcare in addressing the stigma of seeking mental health support, especially amongst our employees.
I think it's evolving certainly over time, at least in my experiences. So we certainly I've seen more and more willingness to have open conversations with me about, as a team member, an individual's own emotional and mental well-being, about their family members, their kids. And when I used to, and I still do set this boundary. So when I'm talking with, whether it's a team member whose child I'm seeing in clinic, or it's talking to them about, these are some good opportunities to enhance your own well-being. Again, EAP, RISE, outside providers. I always say, I'm never going to bring this up in front of anyone else. And I'm not going to start the conversation just being super mindful from a privacy perspective, right? So if I'm saying, how are you? I'm truly just asking that. It's not about, you don't have to dive in and tell me how therapy's going or anything like that, right? So
Right.
I try to set that expectation really clearly, because I don't ever want anyone to feel put on the spot or feel awkward when,
Right.
you're back out in the work environment. But more and more, especially really over the past 6 months, I'm in situations where I'm like, whoa, there's people around. You're going to keep talking to me about this? Like coming up to me and having those conversations. And they're like, yeah. I mean, I talk about it with everyone. I'm like, I should be embracing that, right? Like, this is the stigma reduction, the open conversation, the sharing, the letting everyone know that you're not alone by sharing your own perspective. And that's why it's so important for me to share, you think even about my own therapy, because you need to see others that are doing it and knowing that it's okay. And it doesn't mean that anything is right or wrong or otherwise. It's just one more way to give yourself the time that you need to recover and make sure you're getting all of the health pieces that you need to.
Which allows you to do your job better and be a better partner, be a better parent, all the pieces. Everything's better when it all comes together. Yeah, I love that. And I love hearing that how the environment is changing at All Children's. I think we're making some inroads across the health system and nationally and internationally, but I think it's slow. I think it's slow.
Well, and I think it depends dramatically too. When I think just having a positive experience can be so beneficial, but I don't want to be naive that there are still negative experiences that people have had as well. And
Right.
mental health and access to mental health, especially in Florida, is an incredible challenge. And so finding high quality providers that take your insurance is incredibly challenging. And if you just keep hitting roadblock after roadblock, that's part of like how the stigma doesn't get reduced, because it's causing more frustration and more emotional challenge than getting the help that you need. And so the access piece is something that I'm so mindful of, because if you're out shopping for a therapist because you should be considering it a relationship that you should be looking for the right person, right? It shouldn't,
Yeah.
the first person you schedule with may not be the right person, and that's okay. And if we are, again, hitting roadblock after roadblock, then you're going to get frustrated, you're going to be exhausted, and that's only going to worsen your overall behavioral and mental well-being. So that is, again, really something, especially in the state of Florida, where we have challenges with access to high quality mental health care and evidence-based intervention that I'm continually monitoring closely.
So important. And I think to your point about access, like if we can't access the care we need, then there is a piece of, the why can't I access this? Why isn't this available? What am I not understanding about? Or, and it could lead us down these roads of maybe I shouldn't have this if it's so hard to get. Maybe that's not the right thing if nobody's doing it. Or, there are a whole host of ways that thought process can go.
Yeah.
Um, I clearly could keep you talking all day. I want to ask at least one more very specific question before we wrap up, and that is, as we're talking about access, one of the things that we've talked about a little bit, and that you've been working on, is bringing together a variety of different resources into sort of a cohesive network of support structures at All Children's. We have something similar in the health system at a sort of a system level called MESH, which stands for mental, emotional, and spiritual health. And it's a collaborative of folks. But tell us a little bit about that, what that looks like at All Children's.
Well, Lee, I was so honored that you invited me to mesh at the system level, because I got to see what you all were doing, and you have the responsibility to bring together all of us across these multiple hospitals and talk about how to coordinate care for our team members and what our teams need and what's happening. And as I sat in that first meeting with you all at the system level, was thinking, we have all these well-being opportunities and initiatives happening here at All Children's, and we're not bringing them together in a way that we can coordinate, or we can maybe make a grant application or make a philanthropic ask that is cohesive and thoughtful for all of our team members. MESH is the perfect opportunity to bring everybody together. And so I talked with you and Carolyn and then our local executive leadership here and said, I'd love to bring this down here and start our group so that we could be doing the same thing in our hospital and being, that entity outside of the system that really is so far away from the rest of the entities in the Mid-Atlantic. Sometimes our needs are different. Sometimes the hurricanes make things a little bit more challenging, our disaster efforts that need to be thoughtfully approached here. So I really just started talking to everybody who was leading a well-being initiative and said, this is what the system's doing. I'd love to start it here. Do you want to be involved? And even this weekly, I just had 2 new team members come in who want to be even more engaged, a nursing leader and then a leader from our Office of Medical Education, because these are all of our teams working together and everybody has input and everybody has phenomenal ideas, but we should be coordinating what's available. It's not just about, listing our well-being resources that are available, but talking about programming and what we can do. And so it really, because people are so engaged in the well-being space, came together so easily. And I think this June will be our 3rd month with MESH in place. And I've been so excited. Our team members have been emailing me what they're hearing from their teams, what they're hearing during rounds, so that our agenda is robust.
Fantastic.
Yeah, it's been exciting. And sometimes, when it comes to these meetings, sometimes it's just having the admin support to have a team site, right? With all the agenda and minutes in one place and everyone feeling empowered to add to that agenda because it is like a living document. And then really just diving into it and then knowing that the team is so engaged, they're going to follow through with the deliverables in that intermediate time period too. But we've modeled it for workplace violence as well, a workplace violence prevention team, by starting off every meeting with just like, what's the well-being of the teams look like? What are you hearing from your team? What are you hearing across the organization? And then from there, do you have ideas or thoughts, or are there things that we need to be thinking about? Because this occurred to me last month, actually. Hurricane season starts for us next week here. And because of the loss and devastation from the last set of storms, I was thinking, gosh, like kids who were displaced. My son never went back to his original school. He go back to school at his original school next school year. But our kids who were displaced from their homes, right? We had an enormous amount of families displaced from their homes. Families displaced. Are they going to be panicked? Is the anxiety going to be higher than we've ever seen before heading into the next season? And interestingly, I had a couple parents reach out last week and they said, I think that the talking about hurricane season is what started these sleep problems. And so,
Interesting.
right? So, like, even just getting the teams together to say, should we do a Schwartz rounds on, recovery and resilience from disaster? Maybe not focus so much on storm season, but more focused on how we recover and how we have recovered. And that was a whole mesh initiative. So I'm really proud of the way the team comes together to think about those things and how we can coordinate across all disciplines to make sure our team members get what they need.
I love that. I love that, especially as we, like you said, feel challenged with access. Like if we can create that sort of network or safety net of connected support, that's so meaningful.
Yeah.
Well,
Thank you to you because you brought mesh to us and you
Oh.
brought me to mesh. So I can't thank you all enough for that.
well, it's really amazing to see what you guys have done with it. Okay, like I said, I could keep going all afternoon, but we should probably wrap up. Jen, thank you so much for being here. I really enjoyed our conversation. I know our listeners will too. With that, we'll sign off. This is Lee Doherty Biddison, your host for this episode of Vital Conversations. Thank you to Jen Katzenstein for being here.
Thanks, Mike.
So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email us at owb@jhmi.edu.